Hey guys, we're here at Gosford Chiropractic Centre with Dean. Dean's just going to go over some things to do with the spine and degeneration of our disc.
Okay, here in the clinic we talk to our patients a lot about the phases of degeneration. These are well published in the textbooks. And things to consider is they talk about a segment of the spine being, three joints: the disc and the two facet joints at the back. If you have a lot of tension in your spine, that might be posture induced, might be injury related, but that tension, just for example muscle tension, will create compression through that joint, and that joint has to now move while it's under resistance. And this can be the source of what some people describe as like creeping or grinding in their joints. You might hear it in the knees, the term is crepitus, in the elbows, but you can definitely and also have it in the spine. And if you can imagine, if that tension ongoing after months, years, decades, it can actually lead to a progressive deterioration in the health of any joint in the body. So here in the centre, with massage, dry needling, acupuncture, chiropractic, spinal manipulation, we're all about taking that and alleviating that tension off the spine, off the joints, so you can function at your optimum from that level. Yeah.
So what would be, if we've got kind of this, what would be a pain or an issue that might kind of present to us that might be leading to this?
Yeah, so once again, we've mentioned in previous videos, tension in any joint function creates resistance. And if you load the tissue under resistance, you're going to stress tissue. So you can stress joint capsules, you can stress the disc, you can stress the ligaments or tendons in the area. Any tissue like that, soft tissue, then can become inflamed, and that inflammation around the nerve is what turns on pain. So by removing the tension, massage, other soft tissue techniques, acupuncture, chiropractic, we are addressing the pain in that way, and we're also preventing this degenerative process as we do so.
Down the end doesn't look that healthy, that spine down the end.
No, so nice, healthy, hydrated spinal segment can become very, over the years, stiff, dehydrated. This is where you definitely get that joint achiness from arthritic, degenerative, osteoarthritic pain. This is preventable, it's avoidable, and once again, in the hands of non-drugs, non-surgical care.
Thanks Dean for really answering some of those questions for those guys at home, and stay tuned for some other videos guys, we're going to go through some other things.